So today we're going to be talking about iliotibial band friction syndrome. The iliotibial band is an elastic piece of tissue that runs from the top of the hip, it inserts into the tensor fasciae lata muscle at the top and the gluteus maximus muscle at the back, and runs down onto the outside portion of the knee and inserts on Gerdy's tubercle. So today we're going to talk about number one, how to tape the ITB with kinesiology taping to unload it and hopefully relieve pain. We're going to talk about a mobility exercise to work through any tension that develops in the ITB, and we're going to talk about a motor control exercise to improve muscle control around the gluteal muscles. So first of all, our taping technique. We're using sport tape, which is a kinesiology tape. We've got one long eye strip which is going to go along the ITB itself, and then two smaller eye strips that are going to go over the insertion point of the ITB. You'll notice, as always when we use kinesiology tape, that the ends are rounded. That's going to help the tape to stick and not rub up on the clothes. So the first strip we're going to use is the long eye strip. So we tear off the back strip and stick it down, firstly with no tension. And we're just going to curl it around the path of the ITB. We'll peel the rest of the tape off the back, applying about 25% tension, so if that's 100%, 50, 25. And we're just going to bring that round along the path of the ITB, and then no tension as we stick the end down. First eye strip. Well, we're going to put a little more tension through here, about 75%, just to unload the bottom of the ITB where the pain symptoms are. Just being careful to avoid the crease of the knee there, because that can sometimes irritate. Our second strip, exactly the same again, about 75% tension. Lay it down, and again no tension at the end. You'll notice we've got the leg in an adducted position, it's toward the midline, just to put a little bit of stretch to the ITB. Okay, now we're going to show you some rehabilitation exercises we use to treat ITB friction syndrome. There are many exercises we use, but we're just going to show you a couple today that hopefully you'll find useful. First exercise is a strength exercise to improve the muscle control around your hips, particularly in the posterior gluteus medius muscle. So first of all, Danny is going to place his feet shoulder width apart. You'll notice he's got the resistance band around his knees. He's going to take his knees again hip width apart and maintain the tension in the band. This is going to help to increase the effort in the posterior gluteus medius muscle. Danny, if you want to put your hands over your chest, that's it. That just prevents any cheap movements by digging your elbows in. And then he's going to just lift up through his hips, thinking about gently squeezing his gluteal muscles, his buttock muscles. He's going to take himself up into that nice position where his hips are nice and flat, there's no rotation. And he's going to start off by holding himself there for 10 seconds and do about 10 repetitions. Exercise number two is a mobility exercise. It's an attempt to stretch out and mobilise the iliotibial band itself. We're going to use the foam roller to do it. It's an excellent piece of equipment. It's highly uncomfortable, but then that's not always a bad thing. So Dan is just going to show us how to use it now. First of all, we'll take the foam roller, we're going to place it underneath the hip. If you could do that for me, Danny. He's going to cross his top leg up and just put a little bit of weight through the leg there. Also bearing a little bit of weight through his upper arm, and he's just going to gently slide over until he feels the pain. Some things it's good to feel pain with, some things not. This it's good to feel pain with, and just zoom in on Danny's pain face there, that's nice. What we're trying to achieve is about 2 minutes in this position, just working up and down, go as far as the hip itself and down to just above the knee. Bear in mind, if you are suffering from ITB friction syndrome and you do have a particularly painful spot just at the bottom, perhaps best to avoid rolling directly over there. So, hope it's been helpful. Crack on.